pressure. Later I'll actually show you the demonstration how to use the filter. So I have a few doctors, which is actually really funny. Okay, so when they're filtering, they see inside the filter there's balanced product, right, of exosome. They try to pull that out as well. So that is actually what we're separating, correct? So if you're pulling that back in, that means you're not filtering, right? So whatever is inside of the filtration system, let it be, correct? So don't push the pores in, push the pores out, because the filter is very delicate. It is below 22 micrometer. Okay, it's very tiny pore. So if you push a very hard pressure into it, the filter pore will definitely bolos, lolos, or what? Bolos, yes. Okay. Indonesia is bolos.
Lolos.
Lolos. Malaysia is bolos. Indonesia lolos. In Philippines, puncture, break, tusuk. Yeah, rosak. So I'm making a joke out of it so we remember it, okay? Because while we are working with it, these are all crucial part of determining that you get exosome and nothing else. Okay? We are here to get exosome, correct? Good night. I'm so sorry, I'm boring. Okay. So remember, we need to get exosome, right? So if you're going to destroy the filter, you're not going to get exosome. Okay? You may get bigger particles than what we're supposed to get. So this is going to be a quiz. What is our exosome size?
50 to 70.
30 to?
50 to 70.
Okay, actually 30 to 100 is where we actually want to see the exosome in. Okay, so the filtration is 22. So you will definitely get something in between that only. But if you break the filter, then you just get plasma packaging. Okay? Okay. So why filtration? Okay. So we want to remove the cellular debris, the apoptotic bodies, and the larger vesicles that cause inflammation. Okay, we want to ensure a cleaner exosome population, which is between 30 to 100 nanometers, like I said earlier. Reduces the chance of introducing pro-inflammatory byproducts of the patient into the system. Okay, why double filtration for the IV? Why? So the same filtration, why we do it twice? Because first, filtration to remove larger debris, which is like cell fragments, fibrin, apoptotic bodies, and microvesicles, which is above the 200 nanometer. So when you do that, the filter, the first time, the filter will definitely break. Okay, so when you're going on the third tube or the fourth tube, the filtration is no longer that pure. That's why we give you double filtration. Okay, so the second filtration is to ensure removal of pyrogens, bacteria, and residual aggregates, because you're doing this for IV. Can you do PRP for IV? Please say no.
No.
Oh, so scary. No, you say no. So this is the reason why you cannot do PRP IV, okay? Because you may cause clot in the system. Yeah? So remember guys, when you're using exosome is different, when you're using PRP is different. Jangan salah now. Because udah shock guna exosome, you use PRP juga sebagai exosome. I'm warning ya. I've already stated. It's no, yeah? Okay? This is very important. That's why we're having a discussion. I'm not giving you a lecture. Okay? The next is, hence, IV always require the highest purity standard. We got that point? Point, yeah? So IV, how many filter? I want loud.
Two.
IV, how many filter?
2.
No. IV, how many filter?
Double.
Double. Oh my God. 2. IV, how many filter? 2. Very good. So 2. I want 2. Okay, yes. Okay. So, this is okay, very important. Now we go to patient preparation protocol. Okay, there's no hardcore rules to this, but if you can actually follow it, is better. But there's no hardcore rules to this. Okay, so fasting requirement usually is because we have already discussed about the hyperglycemic state. We did, right? So what we're trying to say here is try to fast more than 10 to 12 hours. 18 hours is better. 24 hours is even better because you'll be releasing a lot of growth factors. Okay. Plain water is allowed. Okay. No supplements. If you have medication, depends on what medication you are taking. Okay. If it's really crucial for your hypertension or something like that, then it's okay. You can go for it. But if in case it's like other medication that you're taking on a daily basis, you can actually stop them for a bit. Or one day there's nothing going to happen. Seperti kamu lupa loh makan obat, right? It's something like that you forgot to eat medicine. Okay, so you reduce lipemia, clean the plasma, higher purity. Okay, prevent cyclomicron contamination that interfere with centrifugation and filtration. Okay, so for IV therapy, avoid any IV infusion. So I know some of my friends are very smart. They say, hey, you know what? Don't give vitamin C. You know the vitamin C in the plasma, it will signal more. No, you do not want to do that because you want it to be as natural to your body. Nothing's forcing out of your body. Okay, so you have to drip within. No IV drips within 48 to 24 to 48 hours at least. Why? Because we can have an acute oxidative shift with vitamin C, especially vitamin C and glutathione. They always oppose each other because they're both very high in antioxidant. Okay, acute metabolic activation that will actually happen with carnitine and B complex. Okay, you may have mineral spikes like magnesium and zinc. You do not want that to be disrupting your exosomes. Okay, and then there may be changes in immune cell signaling. Okay, so dilutional effect on plasma protein 48 hours provide a stable baseline for the autologous exosome biogenesis process. Okay, so you want as natural as possible. All the preconditioning is done. Now, just trust your system and your body. Can we? Can, yeah? Okay. So, hydration, okay, on the day of your exosome, okay, hydrate well the day before. Okay? If you hydrate so much on the day that you're taking exosome, now your plasma is going to be diluted. Do you want a diluted plasma? No, right? Okay. So avoid overhydration on the morning of the procedure. That's very crucial, okay? And then avoid these for 3 days before harvesting. Smoking, alcohol, high sugar meals, heavy exercise, sauna infrared, acute detox protocol, and very severe exercise like gym. If you're going for a walk, it's okay. But you do not want very heavy exercise. Yeah?
How about hyperbaric?
No. Nothing. Don't disturb. Don't disturb the whole system. Just let it be. Okay? So why? This create acute inflammatory exosome. Because your body will definitely want to fight it. Okay? So the day of the procedure, minimal stress. Somebody asked me, can they have sex or not? No, it's a legit question. Can you have sex?
Can.
Yes.
Is it relaxing or stressful for you?
It's good.
So it's a relaxing sex, maybe. But it's very stressful sex, please don't. Okay, because I say avoid exercise. But this is a legit question, yeah. Person called me, okay, Jenna, can I have sex? I'm like, what? For what? And I said, oh, because I want to come and do exosome today. I said, oh. Okay? So, rest 10 minutes before your vein puncture. Okay? And avoid excessive water. Yeah, I told you that already. Okay? Thank you very much, guys. Yalla, exosome